we actually have a slogan, and the slogan is to put some motivational force in our spirit in order to work with the company with the required zeal that it deserves, because the company promises that with its beautiful products, it will deliver sound health to mankind. And you all will appreciate and enjoy what the company has to offer. So our slogan is a form of greeting. If I say EMD, you will say Multi-Dynamic International. EMD is an abbreviated form of Everhealthy Multi-Dynamic. So that is the meaning of EMD, Everhealthy Multi-Dynamic. So if I say EMD, everybody will say Multi-Dynamic International. If I say the second time, EMD, everybody will respond, good life, sound health. The third time I'm going to say sound health, everybody will respond, a spark of financial freedom. This is the way we welcome our friends to our programs or our seminars on this platform. So I'm also going to welcome all of you with the same slogan, EMD, Multi-Dynamic International. EMD, good life, sound health. Sound health is spark of financial freedom. Gentlemen and ladies, once more again, we say you are highly welcome. Right now, as it relates to Ghana, we have 22 brands of product that are existing now in the country, Ghana. However, more brands will be arriving in few days to come, and you guys will enjoy what is happening. But for the new friends that are joining this place for the first time, it will also be good we give you a little background behind this company. It is all about health and network marketing. Technical crew, take me to number 2. For those who love network marketing, you can benefit from the words of Robert Kiyosaki. And as you can see on the screen, network marketing is a business model that has stood out from the rest. These days, network marketing is becoming more and more popular, gaining more and more attention and benefiting a whole lot of people, because it's a very, very flexible system of business, and that is called network marketing. The company is into network marketing and also into healthcare. The name of this company is Everhealthy Multi-Dynamic International. Take me to slide number 3. The history behind this company. Everhealthy Multi-Dynamic is what you are seeing on your screen. It is a system of practice in India that is called Ayurveda. This system of practice was established over 3,000 years ago by a man called Dhanvantari. Ayurveda is a Hindi word. Ayur means long life, and Veda means science. So it is the science of long life. The science of long life. A history that has lasted over 3,000 years ago. And the company Everhealthy is being spearheaded under the leadership of Dr. Gurudev Singh. The company has been into herbal healthcare manufacturing since 1993 and has been serving people with Ayurvedic herbal formulas for decades now. Working portfolio of marketing. The system of practice we are introducing you today is called Ayurveda. Ayurveda is an old system of practice. And the purpose of EMD using Ayurveda to establish its company is to provide people with ultimate solution for all health problems in complementary and alternative medicine, herbal medicine, naturopathy, Ayurveda, personal care, herbal skin care, and various healthcare products. This, our system, is one of the world's oldest holistic body healing systems, developed more than 3,000 years ago with the belief that health and wellness depends on the delicate balance between the mind, body, and the spirit. Over the years, the company has been delivering sound health and good healthcare products to people. We want to let you know that we do not deal majorly on supplements, no. The company majorly deals on remedies, curative herbal remedies that is designed to bring a lasting solution, not to palliate a case, but to bring a lasting solution to healthcare challenges. Our vision is to provide superior quality healthcare, quality healthcare service that everybody will fall in love with. Physicians will prefer for their patients, and purchasers will select for their clients, and everybody will be proud of. Investors will also seek this opportunity for a long-term returns on investments. Our vision is to deliver a healthier community by connecting people to real health and medical care products. The business is anchoring its activities on some core values: integrity, trust, accountability, commitment, constant improvement, leadership, passion, quality, and simplicity. These are the principles that are guiding the practice or the movement of our dear company, Everhealthy Multi-Dynamic International. So we believe that as you are here, you are going to benefit yourself with the products of the company, and at the same time, you will enjoy how the business of the company can take care of the cancer of the pocket. Now, like I said earlier on, in Ghana now, we have about 22 products. 22 products that are existing in Ghana. Now, permit us to touch some of the products that you have there and what they can do before we now go into the subject we want to discuss with you for today, so that we can learn how to tackle some issues around us. Now, technical crew, take me to the products. Some of the products that we are having now, as you can see on the screen, we have some nice things there showing, popping up on the screen, as you can see. Right? These are some of the products, and some of them are there in Ghana. On your screen, you can see the Big Comfort oil, the Big Comfort capsule, the Adeno Plus. We spoke about this one last time. Let's jump to the next one and see new things we can talk about here right now. Very good. On your left-hand side on the screen, you'll see the medication, the product that is written as Vita PS. Let me see if it's among the product that is there in Ghana. Okay, no, Vita PX has not arrived Ghana. Where we have the TC Dental that is there. We have the
there is Vita
500. Okay, there is Vita PX in Ghana, right? That Vita PX you are seeing is a tonic that is specifically designed for the liver and also the well-being of the family, and like a blood builder. Vita PX is designed to improve the digestive system of everybody in the family. If a child is suffering from jaundice, I know you know what is called jaundice. If any child is having jaundice, Vita PX is the best approach to jaundice. Now, people that are suffering from hepatitis, Vita PS should be in the combination for those suffering from hepatitis, because Vita PS repairs and builds up the liver and repairs damages. Hepatitis is a form of injury that is being done on the liver by a particular virus. And when it begins to puncture holes on the liver, it can cause different problems, inflammation of the liver, even cirrhosis of the liver. We will take this as a major discussion for the next seminar that we are going to hold with you, so that we can have a deep understanding of how the human digestive system works and what happens in the human liver. But this Vita PX or DEXA Health, you can call it Vita PS or you call it DEXA Health, because 8 diseases are combined together in that single production you are seeing there. In order to build the blood system, to build up the body of little children, and also to take care of the internal visceral organs, and will help us to live a healthier life. Remember that the stomach is the mother of all diseases. And you know, we always add this particular medication anytime we are treating stomach ulcer. To your right on the screen is what we call the charcoal juice, a combination of 3 particular plants that are designed to assist in bringing down the blood pressure. A lot of people today are suffering from blood pressure. It could also be possible that anybody can be having blood pressure without knowing that he or she is having blood pressure. If you have gotten to the age of 40, always develop the culture of checking your blood pressure. because blood pressure is a silent killer. It can kill at any time, and it can cause permanent deformation on the body. We don't need to tell you much about how dangerous high blood pressure is, but I tell you that high blood pressure is a dangerous problem. If you see what we wrote there, charcoal juice, and it is designed particularly for those who are suffering from high blood pressure, then you will understand that somebody who is not suffering from high blood pressure is not supposed to take that medication. So you see that that medication is not a supplement. A supplement is something everybody can take, but a remedy is something that is targeted for a particular form of sickness. Not everybody can take a particular remedy. Remedy is taken based on what is the issue with an individual. But supplements, any person can take supplements. The company deals majorly on curative herbal remedies. At the same time, we also have some supplements, like the Kabu 500 that is up there is a supplement. The double stem cell, which is called a Vital Trace, is a supplement. Anybody can take these ones, but majority of the medications that are here is actually designed for particular trouble. The TC Dental is one of the excellent remedies we have for tooth problem. If your teeth is bad and your teeth is decaying, you can save yourself with TC Dental. You always suffer from teeth problem, cavity, infection in the teeth, and other issues that has to do with the mouth. TC Dental is one of our ultimate approach to dental problems. Take me to the next screen. So there are a whole lot of things that we have to offer in the company. The Chodex 3 you are seeing up above there on your left-hand side of your screen is actually designed for type 2 diabetes. Those who are having high sugar levels, hyperglycemia, Chodex 3 brings it down effectively in combination with powerful Ayurvedic herbal remedies that is designed to bring down your sugar level. You can see from that place that Chodex 3 is specifically designed for those who are suffering from diabetes. It is not a supplement. It is not what everybody can take. It is particularly targeted on certain people, those who are suffering from diabetes. The clean detox that is by your right-hand side is what everybody can take. One of the things we used to tell people when they come to our company is, if you want to test and know if this product of the company can work very well on your body, you can just pick a cup of clean detox. Only 2 capsules you take for tonight. The following morning, you must say something beautiful about the products. You must get a picture of where the company is going because of what you will experience in your body. It's a total reformation and refurbishing of the human system. That is the work of that clean detox. You see, you may believe that you are a healthy person, but I tell you, if you are being examined under the health microscope, you will find out that all of us are not healthy people. We are all sick in one way or the other. Although you may not be sick as those who are lying on the bed in the hospital, but I tell you, our body all needs attention. Every day, a lot of things happens in our life that needs medical attention. One of the things we can save ourselves the last dance is by using the clean detox. And you will enjoy the beauty of this company. The Coach Vite 3 you are seeing below the clean detox is actually designed for those who are having problem with their pancreas. Diabetes type 1. Diabetes type 1. The people that their pancreas can no longer produce insulin. Coach Vite 3 is a wonderful rejuvenator and brings back your pancreas back to life, and also be bringing down the sugar level in the body. A lot of people have enjoyed using various products from this company. The Danjanten is designed for those who are sexually weak, and Duravine is designed for those who are having issues with cholesterol and then digestive trouble. Now you can also see some other products. The Vital Trace, we have spoken about them, that you can use Vital Trace, anybody can use Vital Trace. It's a double stem cell plus. It's a great rejuvenator and a renewal of the cells in the human body. The story behind stem cells and other things associated with it can never be overemphasized. However, what makes the difference with our products with other stem cells is that in our stem cell, it is not only the combination of stem cells from 3 plants, but the addition of 13 extra Ayurvedic formulas that are designed to complement each other and to provide a degree of healing to the human body. You also enjoy using our stem cell, which is the Vital Trace. Everhealthy drop is a great immune booster. Everybody can put drops of Everhealthy in a water and drink, and you see how your body, this Everhealthy you are seeing is combined with 5 different Tulsi plants that is designed to boost the immune system, remove cold from the body, and also improve the respiratory system. The SP yeast, another name for SP yeast that you are seeing down below the Everhealthy on your screen there is the SP yeast, designed for those who are having serious problem with the lungs, especially asthmatic people and those suffering from cough. Any disorder that has to do with the lungs, these are the things that that product will clear. Gentlemen and ladies, believe me, you will enjoy the usage of these products if you try them. The IQ Vision that you are seeing there is designed for eye problems. The IQ Vision designed for eye problems. The eye is the vision of the body. The light of the body is the eye. Sometimes I used to wonder which disease is the wicked and the most dangerous disease on earth. I don't know if I will say it is blindness that is the worst, because I tell you that when a man is blind, I tell you the whole world is dark. Blindness is something that we must not allow to happen. But alas, we are living in a time when a lot of things can cause us blindness. Are you aware that accumulation of sugar in the body can bring about blindness? Are you aware that depositing of sugar in the body can blur the vision? There are different kinds of eye diseases that we are facing, and you need to help ourselves with the IQ Vision. The God Juice is designed specifically for those who are having kidney-related issues, kidney stones, and the rest of them. There are several products that this company have, and we cannot exhaust all of them. You can see now on your screen the noni juice. The noni juice. I know that most of you have heard that word noni, and some of you may have used some forms of noni, including the Tahitian noni. This time around, the Indian noni comes with even the combination of ashwagandha and 5 other herbal curative remedies that is designed to help our life. Gentlemen and ladies, right now in Ghana, we have 22 products, and more products are flowing into Ghana already. And I bet you that in this year, beautiful things will happen in Ghana that will give all of you opportunity to break different borders, because the products of the company are working. I tell you, the products of the company are working. The FS Desire you are seeing on the top right on your screen there is the FS Desire oil. This oil is actually meant to increase, to shape, and to elongate the size, shape, and strength of the penis. For those who have small penis, and they want to increase the length, the shape, and size of the penis, you can enjoy the usage of our FS Desire oil. In Nigeria here, we call this oil the rod of a Sakaba. The rod of a Sakaba. This oil can help improve your sexual organ, improve the length, the shape, and size of your penis. And what will you experience along the way? We call it you sexual organ at all times. You have a sexual organ that is reliable, that anybody can rely on, that it can perform optimally. Gentlemen, on this note, let us zero down our final discussion to the subject of the day, the prostate gland. We are focusing on a particular product of this company that is called Prostatic. It is one of the products that is already in Ghana. Technical crew can, if we have that picture here with us, so that the people can be seeing the product we are talking about. It is called Prostatic. It is designed for those who are suffering from prostate problem. Do you know the danger of having prostate disease? Hold on for it to come up on screen. Thank you very much. You can see what you're having on the screen. Why did we decide to bring this product for today's discussion? 90% of the problem that a man is facing with his health today has to do with his prostate gland. The prostate gland is designed by God and put in the body of every man, and it performs a whole lot of beautiful beautiful activities. But as you grow older in age, there is a tendency that the prostate gland will begin to increase and increase and increase. And it can cause obstruction in the urinary system. When a man has started developing prostate problem and the prostate gland begins to increase, we call it BPH, benign prostatic hyperplasia. And it can lead to a man using catheter, and it can lead to cancer of the prostate. It can lead to a whole lot of trouble. Many men are suffering from these prostate-related problems. Every day in almost every specialty hospitals in Africa, they conduct operation on prostate on a daily basis. Only in Nigeria here, every day, thousands of prostate operations are being conducted in order to help a man to urinate. But gentlemen, how much do you even know about this problem called prostate? Now, at this junction, you will watch the following video. The following video you are about to watch now will give us a brighter knowledge of what it means to have a prostate problem. At the end of this video, we shall provide you with a solution that you can use to help every man around you and every man in Ghana. And we believe that this will be of ultimate good to people around you. Watch the video, and when we come back, we shall round up the discussion by telling you what to do about this situation. Prostate disease. The video, please.
Prostate is a walnut-sized gland in men. Beneath your bladder, your prostate gland surrounds your urethra, tube through which urine and semen exit your body. Seminal vesicles and prostate make fluid that combines with sperm cells to create semen. In normal urination, urine flows from your bladder through the part of your urethra inside your prostate, then through the rest of your urethra to leave your body. For unknown reasons, your prostate gland may enlarge as you get older. You have benign prostatic hyperplasia. Your prostate may grow large enough to narrow or block the part of your urethra that runs through it. As a result, your enlarged prostate may slow or block the urine flow out of your body when you urinate. Symptoms of benign prostatic hyperplasia include frequent urination, or urge to urinate, especially at night, weak or interrupted urine stream, straining to urinate. Over time, untreated benign prostatic hyperplasia may cause the following complications: inability to urinate, damage to your bladder and kidneys, or infections, or stones, urine leakage called incontinence. If you have benign prostatic hyperplasia with mild or no symptoms, your doctor may recommend watchful waiting, which includes getting your prostate checked every year to make sure your symptoms or health are not getting worse. If you have moderate symptoms that bother you, your doctor may recommend medication such as alpha blockers. Alpha blockers relax muscle tissue in the neck of your bladder and in the urethra to improve your urine flow. 5-alpha reductase inhibitors may also improve urine flow over several months by reducing the size of your prostate. You may receive a combination therapy of both types of drugs. Medication isn't relieving your symptoms. Your doctor may recommend a surgical procedure called Transurethral Resection of the Prostate, or TURP. During this procedure, your surgeon will insert an instrument called a cystoscope through your urethra to reach your prostate. And a wire tool called a resectoscope will be inserted through the cystoscope to shave off tissue, which will widen your urethra. For minimally invasive variations on this type of procedure, use lasers, microwaves, radio waves, or electrical energy from tools inserted through the cystoscope to remove some or all of your prostate gland. If your prostate is very large, your doctor may recommend an open prostatectomy procedure. An open prostatectomy, your surgeon will make an incision in your lower abdomen. After exposing your prostate, your surgeon will make an incision in its outer capsule. Next, the tissue inside your prostate will be removed. The capsule incision will be closed with sutures. Finally, your skin incision will be closed with sutures or staples. Can't prevent benign prostatic hyperplasia, but the following lifestyle changes can make your symptoms less severe. Avoid medication that can make it harder for you to urinate, such as antihistamines and decongestants. Stop drinking fluids for a few hours before bedtime. Avoid drinking alcohol or fluids that contain caffeine. Try to empty your bladder by double voiding. To double void, urinate, wait a few minutes, and then try to urinate again.
Gentlemen and ladies, are you seeing the seriousness of the problem of the prostate gland? Did you see what it looks like to suffer from benign prostatic hyperplasia? A lot of men are suffering from this problem. And there is much possibility that as you grow older in age, you can develop this very same issue. What do we have in Everhealthy that we can use to handle these problems effectively. For those who have started having the feeling of prostate problem, difficulty in urinating, gentlemen and ladies, from our table, you give them a combination of clean detox, Prostate, and stem cell. Clean detox, Prostate, and Vita-Trace. For those that blood has already started coming out of their sexual organ, because some people who are using catheter already, they may start developing bleeding. Blood may be following their urine that comes inside the urine bag. You can add either Carbo 500 or Nutri-F. The major medications you give them in all of these that I have described here is Prostate. Let me repeat what I mentioned again. I said clean detox, Prostate, and Vita-Trace. And if there is any sign of infection or bleeding, you can add either Carbo 500 or Nutri-F to the medication. But for those who have not developed the problem seriously, for every man that has gotten to the age of 40, it is vital and important you begin to prevent this situation from occurring to you. And what you can be doing is you can once in a while and occasionally, you can pick a cup of Prostate to help and maintain the good health of your prostate gland. This is a challenging problem for every man. But however, what do you achieve by using the Prostate capsule? You want to urinate, but you cannot. You have weak or slow urinating stream, a feeling of incomplete bladder emptying, difficulty starting urination. You experience dribbling of urine. You have developed prostate disease called prostatitis or prostate enlargement or prostate cancer. Everhealthy Prostate is an excellent approach to open up your urine stream and clear away the complications that usually comes with this disease. It is fortified with Gokru, called the devil's weed, and Chandraprabha to deal with a multitude of disease of the kidney, urinary tract, pancreas, and thyroid. Prostate disease is medically known as a disease linked to hormonal changes as a man gets older, and this may cause your prostate gland to grow. Keeping the thyroid hormone healthy is important in maintaining a healthy prostate size. Prostate contains 15 extra formulas to stop the complications that comes with prostate disease. Pains at the base of penis, abrupt high fever, chills, joint and muscle aches, and profound fatigue. Do you know that Prostate contains anti-inflammatory compounds that helps protect against cancer, and 84 minerals that functions as antioxidants to improve your body immunity? Ladies and gentlemen, as you enjoy this life-saving product, observe how your urine streams opens up and you shall be free again. This is how we are drawing the curtain for today's discussion on the products of this company. We have ended it by telling every man that has gotten to the age of 40 or anything below 40, 30, 35 and above, please, you all need to have a healthy prostate gland, and Prostate is the answer. We have spent some good time with you today, ladies and gentlemen, in discussing about the products of the company. At this juncture, we throw the baton to the floor of the room for anybody that would like to ask some questions. Let's get your hands, let's see your hands up, please. Right, we already have somebody on the line, Bernard Donko. Technical crew, please release the microphone for this friend.
Yeah, hello, good evening, Dr. Amado, and I've enjoyed your presentation. In fact, we wish this presentation will continue. So please, should in case someone is having prostate, you made mention of Prostatic, Clean Detox, and Vital. What should be the required dosage?
All right, Sir Bernard, if that's your question, if that's all about your question, you can bring down your hand. We will give you the answer now. All right. Gentlemen, he has asked what will be the required dosage for those who are having prostate problem. Okay. Sir Bernard, it is written on the body of the medication how you will take them, the quantity you will take. But it is usually 1 capsule or 2 capsules 2 times a day. When you get it, you will see it written on the body, the quantity you are going to take. After food is written there, sir, right? Yes, thank you very much. Let's pick another name, Namuka Shina. Namuka Shina, technical crew, release this microphone. Namukasa, okay, Namukasa Shina. Namukasa Shina, go ahead, please. Shina, go ahead.
Thank you so much for the presentation. I'm Shina and I'm calling from Uganda. I just wanted to find out how we are going to get the products in Uganda.
Right, Shina, I didn't pick that question well.
I said I'm calling from Uganda. And I wanted to find out how we are going to get the products down in Uganda, because they seem to be very good products.
Okay, if that is all, you can bring that off your microphone. All right. All right, Shina, what is going to happen? Okay, Shina, yeah, we are very much aware of you friends that are coming from Uganda. I think at the moment, what you will do is we form a link with the team that brought you in from Ghana. I believe that this team came from Ghana. Okay, a shipment can be organized to Uganda, but establishing an office in Uganda may not come so quickly because we will not want to put 10 fingers in one mouth at the same time. But we can assure you that in no long time, seeing the activities in Uganda, we will come over and establish in Uganda properly. But in the meantime, what can be achieved is shipments or the courier service can bring down the products to Uganda. I wouldn't know the team you belong to, But if possible, we can get connected with the Ghana office, and that arrangement can be perfected. But at the moment, I will not talk about establishing the office in Uganda yet, because we are having Ghana. We have not finished with Ghana yet. We are, once we round up with Ghana, the company can breathe in small and then maybe face Uganda. Okay, please, you will try to move along with the process, but your presence will also help the company's spirit to be looking at Uganda. Thank you, Sheena. Vanessa Ari. Vanessa Ari, technical crew, release the microphone for Vanessa.
Hello.
Yeah.
Good evening.
Good
Okay.
evening, Vanessa.
Okay. So my question is, if a patient has diabetes and then he has high blood pressure and then the feet is swollen with ulcer, like sore on it, what combination? And I don't know, these are the probable combination I did on my own, but I want to be sure whether it's okay. And if as the presenter can also help me with it. So I was thinking of Vita Force, Vita Trace, Clean Detox, and then is it Kush Vice 3 Juice? So I don't know. I was thinking of the Kush Vice to bring the sugar down, the Clean Detox to detoxify and then boost the immune system, as well as the Vita Force. I don't know whether Vita Trace, sorry, I don't know whether it's okay or you have some suggestions to give me.
Yes, Vanessa, stay on the line. Do not off your microphone. I want to ask you some questions.
Okay.
Oh, how old is this person?
And the person is in his 50, early 50, I think 52.
Do you know how long he has been suffering from the diabetes?
No, I just, I think this month, the wife came to me and then asked me to go and check the glucose for the husband. So it was then that I saw that there is this swelling and they started the whole story. And then so when I heard this Ayurvedic medications, I said, okay, then let me go and explain it to them. But then the combination, so I don't know.
Okay, I would like to, in order to provide you a better direction, okay. I would like to see what we are going to do, okay? There are informations I would like you to get from this person. We want to know how long he has been having the diabetes. I want to determine the type of diabetes this person is having. Is it type 1 or type 2?
Type 2.
And then, oh, you already know. He has type 2.
Yes.
Okay, let me tell you the better direction you will take now.
Okay.
Now you already have Clean Detox.
Yes, sir.
You have Vita Trace.
Yes, sir.
Now use Carbo 500 in addition and Chodex 3 in addition.
Carbo 500 and then
Chodex 3.
Codex 3. Okay.
Yes.
Okay. So I should leave at the cushion.
Drip Cosvite.
Okay. Yes, sir. Yes. Sir.
Cosvite will be better for those having type 1 diabetes.
Okay. 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 Thank you very much.
Is swollen. If the
yes. Hello. Hello.
All right, I think the doctor lost his connection or something.
Sorry,
Oh.
sorry, I lost my connection. I lost my connection. I'm back. I lost my connection. Sorry. I am back. So use those things as I mentioned.
Okay, sir.
You can do, Vanessa, you can get my number, my contact from Mrs. Ramatu.
Okay.
Then you can chat me on WhatsApp so that I can find out some other information about this person. I will give you more direction.
Okay,
And
sir.
we
Okay.
will bring his case to a glorious conclusion, and the person will be happy.
Okay. Okay.
Uganda, it appears if Uganda, would you like to ask more questions? Because I saw that the hand did not drop down quick. The Uganda friend, okay? If we see your hands up again now, I will call upon you. Maybe you have questions, you still want to ask more questions. Now let's go to Flaming Fire. This is Flaming Fire. Microphone on for Flaming Fire, please. Technical crew, please on the mic for Flaming Fire.
Hello.
Yeah,
Hello.
good evening. Yes, go ahead, Fleming.
Yeah, good evening. This is my first time in the Zoom, so I'd rather prefer to listen to you guys before I ask any question.
Oh, we have spent a lot of time already discussing. So please ask, it's time for questions. You can ask questions. Right, it's like it's the first time coming in, first time, and may have come in late, right? Let's go to NS. NS, enormous technical crew on the microphone for enormous. NS, enormous.
Good evening, everybody.
Yeah, good evening. Welcome,
Yeah,
NS.
Yeah, you're welcome, doctor. So mine is just like an advice. I really enjoyed the presentation and what I saw. You know, I'm so amazed. So what I'm trying to say here is, let's start rolling the testimony. Let's testimonies start coming in. You know, those who have testimony should start coming in. And again, the time for the Zoom, I don't know if they should make justice and shift it a little down, like 2 hours down, because of if we start bringing people prospects, let them not be discouraged because of the time. You know, as 8 o'clock Ghana time, I can bring it down to 6 o'clock, 7 o'clock. You know, that's the advice. Hello.
Yes, we're hearing you. Bring it down to what time is your? Are you saying?
I said I can bring it down a bit, like 2 hours down. If we started 8 o'clock Kenya time, Nigerian time, 9 o'clock, they can bring it like 7 o'clock Nigeria time or 8 o'clock, I don't know, so that it will be a bit down. So that when we start bringing in people, prospects, you know, in a further, what do you call it, subsequent Zoom, they should be discouraged, you know, because of the time, you know, after work, people get tired so that we can rush it. And testimony should start coming in. Thank you, sir.
Okay, all right. There are a lot, you can off your microphone now. There are a lot of testimonies though. There are lots of testimony. Okay, so what we can do now is by next week, when we handle the one of next week, we shall share some testimonies from you, and we shall also demand testimonies that are coming from the Ghana end. From the Ghana end, I think it will make a lot of sense. On this timing issue, we will get the views of many people, majority, before decisions can be taken. All right, thank you very much. Let's go three more hands are up. Pascal Hemans. Let's have you, Pascal Hemans.
Hello.
Yeah.
Yeah, can you hear me?
Very well. Go ahead, Pascal.
All right, Pascal from Ghana, specifically Takrady.
Welcome, welcome, Pascal. Go ahead.
Yeah, thank you. Yeah, I'm a new member, and the greatest challenge now is how to get people understand the concepts and become partners in the entire business. For now, all that I need is some of the technique that will be helpful in ensuring that some of my colleagues at the workplace, in the church, in my vicinity, understand the concept well, so that it wouldn't be as if I have to convince them, but just the techniques that I need that will enable me get them understand the concept and willingly opt out to be partners of this great business.
All right. Thank you, Pascal. That will be all. You can off your microphone. Yeah. Okay. Technique. All right. So we have two things now to deal with: bringing in testimonies and providing techniques. Okay. What will happen is, Pascal, now you stay tuned with us the following week. Let it be part of what we will put together now. Putting up this technique will be a lengthy direction. We will not be able to do that now. We spend enough time with the house already. All right, so let's look at bringing in the testimonies from next week and then technique on how to convince people to come in. I think that will do us good. We've taken note of these 2 points, Pascal. Just link up with us again in the next program that is coming up on the Zoom. All right, thank you very much, Pascal. A good direction. We have the hand coming from Sierra Leone. Sierra Leone, technical crew on the microphone for Sierra Leone.
Good evening. Good day, my leaders.
Good evening. Welcome from Sierra Leone.
Yeah. I'm Mohammed Saluko Kamara from Sierra Leone.
Welcome, Mohammed.
My concern is Everhealthy Dynamic Multi-Level Marketing Component is a very good component with a very good back office platform. But I'm asking if we can get access, for example, to enroll someone directly from Sierra Leone here to the company website or to the company office directly, just like the way other companies are doing. Let me say by using my account, I can link my account to the back office. From there, I can do any transaction I want to do. For example, assuming I want to purchase a product from the headquarters, let me say from Ghana directly to Sierra Leone, or from Nigeria to Sierra Leone, I can get access to use my account directly and make a payment from there. They ship the product to me in my country as for now. Because presently, we want to try how we can bring people on board. But some guys, the fear they have is this. Most of them don't want to give out their money for registration behind the products. You know, they want, whenever they give their money, they can get access to their product immediately. This is the challenges. We have people here who are interested over the business, but however, they want, the moment they give their money for registration, let them get access to their product, because they are hesitating for we to receive their money. At the end of the day, they don't have their product, just like the way other companies are treating them. Because we have entered in, maybe, let me say we have involved in similar situation wherein guys pay their money for registration, at the end of the day, for them to get access to their product, their registration kit, it becomes a problem. So this is our challenges. So I don't know how the let me say the way, let me say EMD, the strategy EMD is doing so that distributors can get access to their product immediately. Thank you.
Right. Thank you very much, Mohammed from Sierra Leone. Your point is well taken. We are talking about having accessibility to their products when immediately they pay their money. It's a normal desire of anybody. Once I pay money, I should be able to get access to my products immediately. So what can be done is, I think the Ghana team will communicate with you on this. I wouldn't know the team where you are coming from, but I'm having a feeling that you are linked up with the Ghana team already. I can assure you that talks are already going on this subject that you have just raised. It is wise to have the product on ground with you at when people are making payments, they are getting their products immediately. I will send this message to the logistic department in charge, but I can assure you that the Ghana team is already in talk with the logistic department on this matter. They will get back to you on this, sir. Don't worry, I think it's gonna be fine. It's going to be fine. It is wise to have products on ground, or it is wise that people pay their money, they should be able to get their products immediately. Arrangements on this is going on. I know about this, although I am not in the logistic department, but I'm aware of this talk going on your matter, including Uganda, where talks has been going on this to make that possible. Don't worry, sir. It will not take long. You will see the magic. You will love it. You will see the beauty. We have 3 hands. Please, after the 3 hands, we shall call it off for the day. Fleming 5, we have spoken before. I'll come back to you. Let me touch Emmanuel and Kwasi. Now, Emmanuel Boateng. Let us have the microphone on for Emmanuel Boateng.
Hello.
Good evening, Boateng. Welcome, Boateng.
I'm asking if this presentation can be more than once a week, and also the complan can be added to the presentation so that the new ones may benefit a lot.
All right. All right. So presentation more than once a week, and the complan. Oh yeah, for about 3 presentations now, we have not discussed the complan. That is true. So we have 3 subjects on hand to handle. Okay, so testimonies, strategy to get people, and business plan. On the issue of having the seminar more than once a week, right? The departments in charge of this are listening to your point. I'm going to get back to them on this one, Mr. Boateng. I've taken note of your own points too. And let us see how the following week will look like. I think we'll have a beautiful time on this subject. I will get back to the department in charge of this, Mr. Boateng, on this one. Okay, we appreciate your input. Thank you very much. I think it's going to help the matter. All right, Mr. Kwasi Saje Allen. Kwasi Saje Allen. Okay, let us on the microphone.
Okay. Good evening. So I'm very happy. I'm Kwasi. I'm from Ivory Coast, Côte d'Ivoire. So excuse me, I speak French. I speak French very well, but I do my best. About 4 questions. So you talk about the company. So you talk about a company, you say that it is an Indian company. But when I come to see the back office is in Nigeria. So there are contact of Nigeria, the back office is Nigeria, or you talk about an Indian company. That creates a confusion in my mind, so that I wanted to know if it is an Indian company or a Nigerian company. And my second question is, if it is an Indian company, it is possible for us to have, it is possible for me and my team here in Ivory Coast to have some image or video of the Indian company.
All right,
That will permit me to motivate them, because when the company is happy. And my third question is about the representation. So I have a great and big team here in Ivory Coast. So I wanted to know how it is possible to have a representation here in Ivory Coast, which is the document, and what is the process to have a representation here in Ivory Coast. Because if there is representation here in Ivory Coast, it will be easy for the country here to have the product directly, and the product will be available here in the country. And to make it very easy, because of the make of payments of Ivory Coast, and I wanted to know about the withdrawal. How time when you launch a withdrawal, how time it takes to come in your wallet. And to finish, I wanted to know if during the Zoom we shall talk about the marketing plan.
All right, Mr. Kwasi, you can now off your microphone. Let's provide responses to the numerous points you have raised. Thank you. Oh, sorry, Mr. Kwasi, my microphone is off. You can have access to whatever you have requested from there about India. You can also visit whenever if you want to. 90% of what you are seeing on the website is because the networking aspect of the company began from Nigeria. The networking aspect began from Nigeria. When the company is properly established in your country, Ivory Coast, of course, and Ivory Coast is doing well, there will be a direct shipment from India to Ivory Coast. You know, a lot of logistics is required for this point you have raised now. A lot of logistics is not a small logistic. So at the moment, what you can do is to create a link from Ghana to you. Since this Zoom meeting is mainly for Ghana people, I think almost all of you came from the same link, all right? So we will take them step by step, step by step, step by step. We will not put 10 fingers in one mouth at the same time. We'll take them step by step. Remember that when company is coming to Ivory Coast too, the company will have to pass through the government of Ivory Coast. And only passing through the government of Ivory Coast is a big process, and it's a big investment and a big process. Okay, so what we can do now, based on the recommendations given from those who brought you in, we will look at the next country to hit, Ivory Coast or Uganda or Sierra Leone, or whichever one. But the truth is that the company does not like going through the window, through the back door. Okay, we want to be at peace with the government of the country. So when the company is coming to your country, a lot of process is required. Maybe you are the head man. You are going to be the head man over there. I'm not appointing you. I'm saying maybe. It's not, I'm not appointing you. Take note. Maybe, so that can form a link with the country and see what can be achieved. So take note, whatever you requested for is very possible. It's very possible. It's very possible. Then we have also said that in the upcoming seminars, in the upcoming Zoom seminar, we are going to bring in the business plan, especially because of the new friends you are bringing in, so that they can understand the concept. They can understand the concept. From Ghana, we shall form a link that will link to you. Don't worry, Uganda, I'm seeing your hand. I will call on you shortly. Let me go to second to the last person for today, Fleming. Everybody take notes. I've taken note of the countries that have come up on board today: Sierra Leone, Ivory Coast, and Uganda. Sierra Leone, Ivory Coast, and Uganda. I've put them down in writing. So that will be the subjects for the coming week that has to be attended to. Let's have you, Fleming, finally, Fleming. After Fleming, we'll go to Uganda and we'll close the day. Microphone on. Technical crew, please on the microphone for Fleming. Fleming, are you there? Okay, it's mute. Bernard Donko, hands are coming up.
Yes. Yeah, hello, Doc. Please, kindly add Kenya. We have Kenya also on the line. So we have 4 countries.
All right, Kenya.
Yes.
So 4 countries now. Let's look at the. We now have Sierra Leone, Ivory Coast, Uganda, and Kenya. Okay. Yes, please. I'm putting it down all right now. Sierra Leone, Ivory Coast, Uganda, and Kenya. All right, thank you very much. We appreciate you, Bernard Donko. Okay, these 4 countries will be on the front burner now. Will be on the front burner when the company has concluded every arrangement with Ghana and every government process with the government of Ghana. We shall now get on to these remaining 4 countries. Gentlemen, please, we beg you to be patient with us. It's a very big project. Okay, the company will be embarking on a very big project on these 4 countries. It's not going to be an easy task, so we'll come gradually. Right, we appreciate all of you. Thank you very much. All of you from every country you came in with. Uganda, will you want to ask any further question, Uganda? Where is the Uganda hand? That your hand has come up and come down, come up and come down. All right, maybe we'll have another better times with you. We want to assure, okay, Shina, hey, Uganda, Namukasa Shina. Microphone, okay, on your microphone.
Hello.
Yeah, go ahead, Sheena.
Okay, thank you for the second chance. But as you think of Uganda, you also think of how we are going to withdraw the money from the back office.
Yes, Sheena, everything is inclusive.
Okay.
Everything is inclusive. That's why I'm saying this is a big project, okay? So we go country to country. That is a big project. Everything is inclusive. Don't worry, Sheena. Okay, after this one hand, nobody again, please. I will not entertain any other question till another seminar. Kwasi, you want to say something finally? Kwasi.
Yes. Hello.
Yes. Go ahead, go ahead, go ahead.
Okay. So thank you for the next chance.
Your network seems unstable, Kwasi. Kwasi, the network is unstable. All right, we cannot hear Kwasi. Okay, gentlemen, please, we can reserve further questions for next week program, which is going to be a beautiful one. We wanted to hear Kwasi for the last time, or his network is unstable. I cannot hear him. Gentlemen and ladies, whatever is your concern, whatever you want to achieve, wherever you want to go, whatever you want to know, we want to tell you that the company has an open door policy. Gentlemen and ladies, it has been a wonderful time with you. Next week is going to be more beautiful than what you have seen today. We shall talk a lot more. We shall make preparations to open one country after another. And we have taken note of the points that are raised from the different countries that have joined us for today. We appreciate all of you. We thank you again. And we want to conclude today's program by greeting you once more with our slogan. And I'm going to use the slogan to close the day. Africans, EMD Multi-Dynamic International. EMD, good life, sound health. Sound health, a spark of financial freedom. Thank you once more for coming around today. And as you enjoy the remaining part of your weekend till we enter next week, we say and we continue to pray for God's blessings on you. And may you all have a nice time, and greetings to your family. Thank you very much.